Thank you for choosing Axxess On Demand. Axxess believes in continuing education, and we create content to empower you to learn and grow anytime, anywhere. Let's get started.
Welcome to Communicating Through a Crisis, what hospices need to know. We're glad that you have chosen to spend some time with us today. We know how important it is to work on your business in addition to working in your business, which certainly takes up most of your time. So we appreciate you being here. For those of you who have registered for this, and if colleagues in your office have not been able to attend today, we're going to send out a recording of the webinar after the webinar. So if you have friends or colleagues who signed up but have not been able to join us today, they will be getting a copy of this. A couple of housekeeping items. Feel free to utilize the chat box on the side of your screen. We have a lot to get to today, but we will do our best to reserve some time at the end for questions. If we don't get to your question during today's session, we will follow up via email after today's webinar. I'm delighted to introduce my co-presenter for today's webinar, Zondra Ellis. Zondra serves as our Director of Hospice Solutions at Axxess. She leverages her many years of expertise in the hospice industry to create a software that is easy to use and allows clients to be clinically, administratively, and financially compliant. Prior to joining Axxess, she served as the Executive Director for Kindred Hospice and Heart to Heart Hospice agencies across Texas. In this role, she oversaw a hospice house, created and implemented a company-wide QAPI program for an organization that served more than 2,500 patients. She has a lot of knowledge to share, and we're delighted that she's participating in today's webinar. My name is Laura Barnett. I'm on the marketing team at Axxess, and I have 15 years experience in communications and marketing, including several years focusing on crisis communications, which is why we're talking today about our topic. During that crisis communications time, I often worked with healthcare organizations, so I'm really excited to help present today's session. So we will go ahead and kick things off and share a little bit about what we're going to be expecting today, what our agenda looks like for our session. So as you know, you saw in our email before this came out, you'll understand why a crisis plan is an important part of staying compliant. We will share how a communications plan is going to strengthen your overall crisis plan. It's a very important component of that, but certainly not the only component. And we will present strategies to navigate through a crisis as well. And one other thing I should mention, in addition to what you have today, as part of the follow-up to today's webinar, we will be sending out a crisis checklist so that you can have some actionable steps to begin to create or refine your crisis plan for your organization. It's not the actual plan itself, but it's a good list of the types of things that you need to be aware of and the topics that you need to make sure that you're covering within your own organization. Zondra?
I'm here. Can you hear me, Laura?
We sure can. Yes, absolutely.
Okay, sorry. Little technical difficulty forwarding those slides. So, why is a crisis plan important? So we all know that it's a regulatory requirement to have an emergency preparedness plan, or crisis plan. So we're going to use those terms interchangeably. So it is a foundation of hospice care, and it was changed a couple of years ago, back in 2017. So we're going to talk a little bit, just real briefly, about what those changes mean for hospice organizations and understand better the why behind it. So, okay, so the big picture is in 2017, like I said, the update to the conditions of participation was built around 4 provisions. So the 4 provisions are risk assessment, policies and procedures, communication planning, which we're really going to focus on today, right? And training and testing. So, and within that, they wanted the emergency preparedness plan or crisis plan to be comprehensive, consistent, flexible, and dynamic. And the reason behind that is when these conditions of participation were updated, they really touched pretty much every healthcare entity or type of healthcare entity. So they want to standardize and align those post-acute providers, so we're all kind of doing the same thing. And if you think about it, that really makes sense. So that's where we get the flexibility and the ability for it to be a dynamic, ongoing, changing and updating tool. Is you need that flexibility because a nursing home is going to function differently than your hospice organization. So think of it that way. But the pillars are certainly important to remember, and to really know that CMS understands some of our struggles that we have and are working hard to build a tool to make it easier for everyone. Okay, so go ahead, Laura, sorry.
That's okay. I'll look next at the hazards. So certainly we've seen in the last year, it seems like crises tend to beget more crises. They come out of nowhere and they majorly or massively interrupt business as usual. They affect patient care, they affect your teams, they affect how care is delivered, they affect safety and well-being. So the first thing is to identify your list of hazards. The issue with this is the unknown unknown, what you don't know that you don't know. We likely would not have anticipated a major worldwide pandemic as an additional page in your crisis plan. Now, certainly that is the case. There are a variety of these types of hazards, so I would recommend that you identify different crises or potential crises in a variety of these buckets, because your strategies and tactics to work through them will differ from bucket to bucket. So, of course, you have natural and you have man-made. Additionally, organization related, so things that will affect care, things that will affect your equipment and utilities, things that will interrupt your communications, cyber attacks, a loss of all or part of a building. We've seen when wrecking crews show up on the wrong property and oops, there goes the building that was not supposed to be taken down, as well as a loss of essential resources. A quick story, as I talked about, I spent several years focusing on crisis communications and worked with a hospital system. I talked about some healthcare expertise in that area. Worked with a hospital system in a rural part of Texas. That hospital, 54-bed hospital, very small facility. They were, and this sounds like a Tom Clancy novel, but I promise it was true. Their electronic medical record provider was hacked by Russian hackers, and the CEO of the hospital had to drive up to Dallas. So it was about like a 4 or 5 hour drive to a really crummy neighborhood and go to a really seedy gas station and buy $17,000 in Bitcoin as ransom in order to pay off the Russian hackers, in hopes that they would get their electronic records turned back on so that they would be able to resume charting as they normally had done. In the meantime, they were charting on paper, and their teams were very young and inexperienced and had not charted on paper before. So there was a big learning adjustment there. So when we think through hazards and the implications of those hazards, that's the kind of thing that comes to mind, is how this is going to affect your business processes and what sort of learning curve or delay is going to take place, and how that's going to impact the work that you do day to day. So identifying hazards is really the first step in what your crisis plan should look like, and that will then dictate a lot of the actions that you take after the fact, but it is a good first step. So the next thing that you're going to want to focus on is the roles and responsibilities of your team members. You're going to want to look at your entire team within this. So certainly you'll want to begin by focusing on your senior leadership team. What is the procedure for activating this emergency preparedness plan? Who is the person, or who are the persons within your organization who will take responsibility for activating that, and at what threshold do things need to exist in order for that plan to be put into place? What is your continuity team? If, for example, someone on your leadership team is no longer with us, let's say, if there was a plane crash, a car accident, a stroke, et cetera, if there's incapacitation, who else is in line to make those decisions and calls? What other team members need to be included in this. And this is the type of situation where you're going to be looking not necessarily at the person's job title or tenure within the organization, but you're going to want to focus specifically on their skills, strengths, and gifts. So if you have a biller who is absolutely unflappable, does not get ruffled, is incredibly calm and focused and serene, that's the kind of person that you want in your inner circle for the crisis plan, even if they've been there for 9 months, right? This is a person that you may not see as a senior leader within the organization, but by virtue of who they are as a person, that would be the kind of person you want helping to make decisions and drive the plan to its execution. So from an activation plan perspective, if you know that you're expecting that service will be disrupted, whether you are seeing that down the road, whether that's coming up in the next 24 to 48 hours, or whether that has already occurred, what does your plan look like as a result of those different timelines? Again, talking through what you know, what you don't know, and what you don't know that you don't know. Those known knowns and the unknown unknowns. Think through the decision to activate that and then go ahead and get that activated. What that threshold is, how quickly things need to move as a result of that plan being put into place. Next, you're going to want to think through that order of succession. So at least 3 individuals, 3 people on your team, the order in which they're going to assume that role, thinking through where they live in relation to each other, in relation to your office. We have all learned in the last year that being at the office or right near the office is not necessarily super important. Many of us have been working remotely for the better part of a year with no real plans to change that. So let's say that there is a tornado. I worked with a gentleman during my time in TV who's a meteorologist in Oklahoma City. He was forecasting the Moore, Oklahoma tornado that came through in 2011, I believe. And he saw that the tornado was coming down his street. So he said, Melissa, get the dogs and put them in the shelter. When you are seeing that the impact is going to occur in a certain area, where are folks in relation to that area? Are they spread out enough in order to hopefully not have withstood the impact of whatever that crisis may be? So, if you have folks in different areas, you're going to be much better suited to weather the crisis. Again, you can describe those by positions or titles. You might also want to, again, include folks based on their skills and strengths. Additionally, you're going to want to include members of your continuity team or your restoration team, depending on whatever you want to call that. But they should be part of that order of succession as well.
Okay, thanks, Laura. That was great information. So we're going to talk about the alternate service location. So this is something that's kind of buried deep in the hospice archives, right? So it's important for each hospice organization to have an alternate service location. So where are you going to continue to conduct your business if your building suffers loss and you can't use it? So you want to make sure that you have a contract with your alternate service location. I'm going to say provider. So whoever owns that building or whoever's responsibility for the space, whoever's responsible for the space that you are going to be using as an alternate service location. So it's important that you communicate with your alternate service location partner. So that needs to be ongoing. So if I was a new hospice administrator, one of the first things I would do on my list, given the amount of emergency and disaster activity that we've had in the last year or so, I would definitely get in touch with my alternate service location partner. I would, go take a look at the space, make sure that our contract is in order. I would also continue that communication throughout the year, whether that's just a short email touching base. Like Laura said earlier, things happen, and maybe your contact there was affected by this disaster, or maybe they moved on to a different opportunity. It's not the time to find out that your contact is no longer there when you're in the middle of a crisis, right? So you want to make sure that you maintain and keep open lines of communication. with that person, and in the event that they leave, you know who to contact. Make sure that you invite them to any emergency preparedness training or maybe meetings that you're having. That is a great way for them to understand what your needs are going to be really coming into the emergency period. So make sure that you communicate where that alternate service location is with your team, where it is, how to access it, and any protocols that go along with it. So you want to make sure that you have, when you're doing your walkthrough, I'm going to digress a little bit, make sure that there is space and equipment that you need. I mean, there's nothing worse than trying to set up an office and you don't have any, you don't have enough plugs, right? You can't plug everything in. So you want to make sure that you're thinking about that. And if you need to buy additional power cords or whatever you need to do, that you do that and have them stored where you can get to them quickly if you need them. So you also want to make sure that you're able to communicate, yet need to have internet of some kind. And so that's a little bit of a, can be a little bit of a hiccup. So you want to make sure that you're really communicating and being strategic about how you work with your alternate service partner. So alternate service location provider, so that you don't get into a situation where you don't have any internet. I know Laura and I have been to many conferences, and you get in those big conference rooms where they set up the exhibit hall. It has internet, but if you've not signed up for it correctly, you're not able to access it. So you want to make sure that you address that. And then also make sure that your medical supply, if you have supplies coming to the office, a lot of organizations have medical supplies come to the office and then the team delivers them when they're seeing the patient. If that's the case, make sure that that medical supplier knows about your alternate service location, and maybe even involve them in a walkthrough so they can see how much area you have to store medical supplies, because it might be smaller than what you have in your office. And then make sure that you have an emergency backup plan for your emergency preparedness plan. So make sure that you have another place, or thinking of ideas of where you could possibly set up camp if your alternate service location is damaged in the storm or during the emergency.
And we certainly saw that last week with the power outage in Texas. You know, if you were on the rolling outages, you had maybe an hour or so of power, and so you rushed to get everything done, and then went back into the dark. So that was another key reminder of having a good crisis plan in place, and help understanding how that's going to impact your workflow. Another impact is your workforce. If your workforce is remote, as I talked about, as many have been for the last year or so, a number of considerations to take into account from a workforce perspective. So evaluating what roles you have. Do you need to right size your organization, or do you need to right size the roles within your organization? Does that mean that you should be looking at again, folks who have particular skills and strengths, and the job title or their daily responsibilities may not necessarily best suit the organization in the crisis, but they have another skill set or strength that could be utilized in a more efficient or appropriate way? Does your team have the equipment that they need to perform their job while they are remote for a current time or an extended period of time? Do they have the access to get on the internet, to the devices that they need in order to do the job that you've hired them to do? How are you communicating with them? Do they need communication in a different way? If you have done, if you reached out to them earlier, or if you know from past experience that they really like to have a conversation with someone, and an oral conversation, whether you are providing praise or providing a critique or feedback of some kind, sending them an email may not do the trick. You may need to pick up the phone, and that's a little bit different than just walking over to their desk if you were in the office. So understanding that your communication strategies may need to be tweaked a little bit in light of having a remote workforce. What are the expectations? We know that folks have a lot more freedom and flexibility while working remotely, Are you expecting them to be able to do the same job in the same hours, or would you be more flexible if they worked late in the evening when they didn't have distractions from family around them while they're at home, that sort of thing? How are you communicating those? And then from an oversight perspective, how are you managing and leading? How are you providing that feedback? And how are you making sure that they're staying on top of goals that you have worked together to lay out for your organization?
Okay, and talking about your workforce, let's talk about human resources and your plan and your strategy to manage and communicate anything that needs to be communicated with your team throughout an emergency. So you want to be thinking about additional staffing. So additional staffing, everybody's short-staffed, but I would really encourage you, if there is a sister agency, maybe you are an enterprise organization and you have another hospice location, 15 or 20 miles away, think about partnering with them to make sure that they have enough staff and that you have enough staff. So really about collaboration and working together. Make sure that you're partnering with your local and state offices of emergency management. There may be resources there. We know that a lot of folks that are involved in emergency management at the government level are clinicians. So, they may have resources that you didn't really ever think about. So, but just make sure that you have a plan and that you have that plan documented. So, you want to have an open dialogue with any outside organizations, offices of emergency management, the Red Cross. So when you go and ask for additional staffing or ask for that support, right, they know who you are and you already have established a rapport with them. So that makes it easier to ask. Think about communicating, planning, or strategizing and communicating with your team about how work schedules might be impacted if you're in an emergency or have a crisis. They need to understand that, whatever your team decides is the best way to make sure that all the patients receive the care that they need and the business continues, that may require some flexibility on their part. And I included time off here because I think it's important when something happens. You may need to tell folks that their planned time off and their trip to nowhere because of COVID needs to be rescheduled, right? And I would really encourage you that the answer is always no unless you ask. So if you set the expectation early that, if there's an emergency, time off may be impacted, and then, ask them if they can reschedule, or if needed, tell them that they need to be rescheduled. You have to have confidence in that conversation, and having a plan and communicating with your team will help inspire confidence in you to have those difficult conversations. Make sure that you're communicating any employee assistance plans that you have to your team. So, those things that we kind of talk about in orientation that we might, just kind of gloss over, we're never going to need that. This really, what Laura and I are talking about today really kind of brings that all to life. So if you have an EAP, make sure that your team knows about it, and think about maybe sending an additional communication or message to them that, hey, don't forget, we have an EAP if you suffered a loss during this emergency. Please make sure to leverage that. Think about your employees with disabilities. And I know this sounds like kind of an odd thing to put in here, but I'll tell you about a fire drill that I experienced at a hospice organization. So we were in an all-staff meeting. It's a very large hospice. We had over 300 patients, so we had a big team. Our emergency preparedness officer decided that she wanted to have a fire drill during that meeting. So she pulled the drill. I stayed back as the administrator, and there was one person left in the room. And the coordinator was very upset that this person didn't evacuate, right? Well, he's in a wheelchair and, he needs help to kind of navigate a big crowd like that. And, that really kind of stuck with me because, your employees with disabilities, we can offer them an employee assistance plan, but, if they've lost needed medical equipment, maybe they're wheelchair bound, maybe their wheelchair was damaged. Those are things that we need to be mindful of when we are thinking about how we're going to care for our teams in the midst of a crisis. So we want to make sure that we have a plan if business has to cease for a short period of time, or maybe folks can't work because of injuries or damage to their personal residences. You never know. You want to make sure that you have a plan and that the plan is communicated how benefits will be continued if they are unable to work. And then also the premium pay structure. So you don't want to, I shouldn't say you don't want to. We'll cover that in a minute. Laura will cover that. What you want to do is you want to have a premium pay structure in advance of any crisis or emergency. And you want to make sure that that is communicated to your team so that they understand what that pay, if there might be a premium pay for times of emergency or crisis, so that in the midst of that crisis, you've already done the communication, your team already understands, and you can move forward with taking care of the patients and running the business rather than working on developing and discussing the premium pay structure.
So here's where your partnerships with your software vendor really come in handy as part of your crisis plan. What does your document management strategy look like? What are your options to back up and store your records? These are the questions that you should be asking when you are evaluating a new software partner. What sort of data storage and recovery facilities do they utilize? What type of offsite servers do they employ? Are they cloud-based? Are there, portable media elements that you can add in or that they can, provide for you? In addition, you should be taking care of your own, forms and documents. Do you have hard copies of your forms and documents? Are there blanks? And are they duplicated in multiple different areas? So as we talked about, having your team geographically spread out if they're part of your, your core crisis team. Perhaps they have files at their home, or as we're talking about, if you have sister organizations in different cities or different areas, perhaps you have some sort of share or exchange program where you're taking on the responsibility and sharing that with your other sister organizations so that you are, kind of creating that safety net as well.
Okay, we're going to talk about patient evacuation. So I have participated in evacuating patients from a hurricane in advance of a hurricane, and it's tricky, you guys. So you want to make sure that you understand patient evacuation and the most efficient way to do that while providing the safety and security that your patients need. So always remember that HIPAA rules apply. So we want to make sure that while we're communicating about the patients that we're transferring, that we are using the as needed rule to communicate about that. So we don't want to put it on blast, all the people that are being being transferred. We want to make sure that we have a precise communication that is HIPAA compliant. So the first thing you want to do is you want to communicate with your state and local officials. So we talked about kind of developing those relationships with those folks, and this is another really good example of why you need to have a relationship with them. You need to know who to call and what their protocols are. So that you know that you are letting them know according to when and how they prefer. So at minimum, patient information should include patient mobility. And I know that sounds kind of funny, but the patients that I received that were being evacuated from this hurricane, I received them. They were on a big bus. We had wheelchairs, walkers, all kinds of things stored on the bus, but really no idea of who needed what. So understanding their mobility needs will make that evacuation much easier, having that documented and be able to communicate it clearly. If you have life-saving equipment, so maybe we've got somebody who's on continuous oxygen, you want to make sure that they have enough oxygen and that the folks who are where they're being evacuated to also has the necessary life-saving equipment. So that's going to require you pulling in your DME. So now we've got your medical supplies and your DME that need to be pulled into your emergency preparedness plan. And then also remember, if you have folks that have special needs, so talking about different languages, maybe someone's hard of hearing, maybe, there are a variety of communication barriers that people can live with every day. And as hospice providers, we work really hard to remove those barriers, and most of the time we're quite successful. However, if the patient's being evacuated, we need to make sure that they don't lose their means of communication because the receiving entity doesn't understand their needs. So, and of course, special dietary needs. We don't want to make anybody sick. If they have a dietary need, we certainly, if they need thickened liquids, we want to make sure that happens. Or maybe, they have not a food allergy, but maybe an autoimmune disorder that requires them to follow a special diet. So those are things that, may or may not be required, but important for you to consider how you're going to communicate those things. So moving on, your evacuation triage, this needs to be practiced, it needs to be communicated, it has to have a strategy, right? So we're going to evacuate those patients according to acuity. So when we talk about acuity, what does that mean? Well, it can mean different things to different organizations. So it has to be patient population focused. So you have to be able to look at all of your patients and quickly kind of put them in different buckets so you know what order you're going to evacuate them in. We have our emergency triage levels, the 3 triage levels, and that's a great place to start. But, there can be groups within each emergency triage level that you need to consider. So how are they going to get there? Now we need a contract with a transportation company. So think about that. That requires communication, not only to get that contract done, but also so that your team knows exactly who's going to transport our patients. Will they need staff support? And so we get to patient records, and this is actually a requirement. So you need to have a means to communicate the patient health condition and history, any allergies that they might have, medication, and then their family member or legal representative contact information. So that definitely has to be communicated or sent with the patient when they're being evacuated. So you've got the receiving entity, you have your patient and their loved ones who need to know what's going on, and you have your team that needs to know what's going on, right? So all of this information, it can be a little overwhelming if you don't have a strategy about how you're going to communicate that. So one of the things you can think about is a quick coding system. So however you're keeping track of your patients, if you're able to go in and maybe you have your triage levels, you can sort that way. But if you want to use a quick coding system, so at a glance you can see a color, you'll be able to pick out those patients quickly. So making it easy for you and your team to know exactly what to do when the time comes. Alrighty, we absolutely want to track our patients. So your mechanism to track patients, family members, and your team. So do you have someone on your team that is verifying the patient or their loved ones' contact information on a routine basis? So, if we say we're going to evacuate Miss Smith and we try to contact her daughter, we can't get a hold of her, and that's because she moved or her phone number changed. That's not a good look. So we want to try to avoid that if at all possible. So we also want to make sure that patient services is identified by the interdisciplinary group are carried out according to the plan of care. If there is a disruption in those services, we want to make sure that we document that and that we also communicate that with our partners, our business partners, and the patient, of course, the patient and their loved ones or legal representative. All of this information should be readily available. Accuracy is important when you're tracking anything, but especially when you're tracking people. So, and you have to have a means to share this information with your team and other providers that need to understand. One of the tricky things are patients who are the lowest triage level for evacuation. Sometimes they can self-evacuate. So what is your plan going to be to make sure that you keep track of those folks? So, when we had the big storm in Texas last week, we had some folks who just left. How do we keep track of those people, and make sure that they're still getting the services that we're telling Medicare that we're providing, right? If you have someone who's able to self-evacuate, but they say you educate them on the emergency preparedness plan, and you get a feeling that they might just run off, follow your instincts there and go ahead and make sure that you have a plan with that patient or their loved ones, for them to notify you where they are, where they're going, and how to contact them. Super important. We don't want to lose any patients.
So another important element is how your crisis plan is going to roll into policies and procedures. We know that policies tend to beget other policies, and those should be reflected in your emergency preparedness program. What's nice about working on your business, as I talked about earlier, is the fact that what you are doing within your crisis plan and the actual work of it and the thought that you're putting into this will help to shore up your other policies and procedures, especially if you're a startup agency, a startup hospice, and you are really beginning to get your arms around the work that it takes. This is something that should be reviewed and updated no later than every 2 years. And as Andra kind of talked about before, if you have a major staff change, if you acquire an organization, if you start up a new branch and bring on a new staff member or new senior leadership team members, etc., those changes should be updated and reflected within your policies and procedures, and that should be available to all team members. And you certainly might want to think through making some of that available to other strategic partners as well, so that they have a clear understanding of how you can support each other during times of crisis.
All right, let's talk about transfer agreements. So this is going to be something that is included in your policies and procedures. So where are your patients going to go if you are limited or have to cease your services, your hospice services? So where are they going to go and how are they going to get there? Those are important things to discuss, and also to be able to for each member of your team, as appropriate, to be able to discuss with patients and their loved ones in advance of an emergency. So, here in Texas, we have hurricanes. So, what is it going to look like for that patient and their loved ones? So really providing that security that the team knows what's going to happen. So you want to make sure that you have contracts with your facilities and that they're clear and concise with what needs to happen. My evacuation experience, it was such an urgent situation that we signed the contract after the patients were on the bus on the way to me. So you don't want to be in that situation, right? You want to have that contract with those facilities, and you want to have that relationship and open lines of communication. So don't forget about transportation. How are you going to move your folks from point A to point B in a crisis? So we know not everybody needs an ambulance. Some of them might need non-emergency transport, but do you have a contract with a transportation company that will allow you to quickly, pick up groups of patients in different areas? So what does that look like? We want to make sure that our patients are not stuck, right, in the path of the storm or in the midst of a crisis. So we want to be able to move them quickly and safely to safety.
So now we get into my favorite part, which is the communications component of it. So from a logistics perspective, Certainly you're going to want to focus on coordinating patient care. That's been a lot of what Zondra's been talking about. And not only do you need to have that plan in place, but you need to effectively communicate that to your team. Everyone needs to understand what the game plan is. We all know that providing excellent patient care is going to be your first priority. Ensuring their safety is your first priority. So everyone needs to be on the same page. This is a time when you need to be checking for understanding. They need to be able to say back to you what the game plan is in their own words. You'll probably want to think through a variety of methods of communication, satellite phones, radios, shortwave radios, etc. As we've been referring back to a week ago in Texas when we felt like we were living in the Oregon Trail and had power at limited times. And when we didn't have power and folks were working off the data on their cell phones, the cell towers were so overloaded that you really couldn't get much cell service. So that was another key indicator that you need to have a backup plan. Also, you want to have the contact information for your staff. You want to have contact information for your contracted entities, for your patients, physicians, as well as for your volunteers. Zondra talked about you want to make sure that you don't want to be signing the contract after the folks have already left your care toward the care of someone else. So certainly you want to make sure that you have that in advance and taking the time to do that before the crisis occurs. And again, you want to update and review that every 2 years at the far end. If you can do that every 6 months or every year, you're likely to be in much better shape. And ensuring that a variety of folks have access to that information so that everyone knows where to get that and how to update that when the need occurs.
Let's talk about means of communication resources. So most of you are familiar with that phone tree, right? So we keep that updated constantly. So we're able to concisely understand who's calling who and when. So that's one means of communication, right? So there are multiple types of communication outside of just regular phones or email. And most of these are facilitated by the government. So they needed them for military use. So I've listed some here. I don't want to belabor all of these. We've added resources at the end of this presentation so that you can access these. But I would say, and my favorite thing is, and Laura kind of laughs when I say this, is that Apple Watches now have walkie-talkie capability. So that's one thing that you could think about that's a really simple way to communicate. Maybe not all of your team has them, but if you can identify the people who have it and how you can use it, that's a delightful way and an easy way for you to communicate with your team. So you want to make sure that whatever you decide on, system and process that you decide on to communicate, is that it aligns with your local Office of Emergency Management, and their communication, right? So maybe you can link into what they're doing. You just want to make sure that whatever you decide in your partnership with your Office of Emergency Management, that you let your staff know what that looks like so that they're not wondering what's going on, or maybe they're just taking the day off because they know nobody can communicate with them. Make sure that you've got a solid plan there. So, and again, these resources are available at the end of this presentation.
So next, we're going to get into how you're talking through the crisis. And this is a session that we literally could spend 6 hours on, and we're going to spend about 2 minutes. So the flying pass at this is word choice is absolutely crucial. Zondra said something earlier about what you don't want to do and stopped herself because making sure that you're utilizing good words. So instead of saying what we don't want to do is such and such, the reason why you don't want to state a negative or repeat a negative word, even to deny it, is that folks have very short attention spans. We've been talking for about 45 minutes already, and I can guarantee that not one of you has paid attention the entire time, and that's okay. Scientists have measured what our attention spans are at this point because so much is demanding our attention all the time. Humans' attention spans are between 6 and 8 seconds. The attention span of a goldfish is 9 seconds. We're worse than goldfish. There's so much out there that is demanding of our attention that you must be absolutely strategic in what you're saying and how you're saying it. So utilizing good words, words that you want repeated about you. If folks hear something on the news about your organization and they call their spouse into the room and say, hey, we need to rewind this, you need to see this because they were just talking about X. If you are sharing good words about your organization, people pick up and repeat what's been said. So you want to feed that right information, the information that you want shared about your organization, how you are weathering the crisis, how you are focused on patient care, how you are aligning with and working with the authorities in the situation in order to create a continuity of care plan so that everyone is taken care of. When questions are asked of you, and this can be, in the media, this can be on, news media, this can be on social media, this can be in person. You can be in line at the grocery store and you might be wearing, your hospice organization's polo shirt and someone says, oh, you work for ABC Hospice. I heard such and such. If someone asks you a question, if you immediately launch into talking points, that sounds and feels very rehearsed and very icky. People don't like that. However, if you acknowledge what their question is and then move into what you want to say about your organization, that tends to smooth things out a bit. Folks feel like they've been heard as opposed to talking with someone who's just there to be a talking head for the organization. But, if they say, we were considering putting my Nana on hospice with you, however, and they share a complaint, if you say immediately, well, our goal is patient care, that may be true, but that's not the right way to communicate that. You needed to say, oh, I'm so sorry to hear that that was your experience. That doesn't live up to the high standard that we set for our organization. You've acknowledged what they have expressed their concern is, and you're able to move into the kind of conversation that you're wanting to have. Again, planning ahead. I have belabored this point and I will continue to do so. If you are in the middle of a crisis, it is far too late to work on your plan. So you may think, why do I need to spend time, answering proposed questions that I might get asked? The thing is, if you are trying to do that literally by candlelight when there's no power and you're in a hotel room, 20 miles away from your house because your house has been flooded and the power is out, that is not the time that you want to spend thinking through, how am I going to answer media questions? So it does not have to be exhaustive, but at least it gets you into the mindset of the kinds of language you want to use, the kinds of points that you want to drive home to your audience, and how you are sharing that with your team, because effective communication starts at the top. So when you, as a leader in your organization, are communicating a certain way, that will spread out into the rest of your organization, and you have that support system of the rest of your team helping to communicate with others the way that you would want them to be communicated with and to.
Okay, so let's talk about putting your plan into action. And I touched on it a few minutes ago about training, right? And so a lot of times we go through orientation and we check the boxes because people have experience working in hospice. They know what to do. There's really nothing special to talk about. That can be improved upon. So you want to make sure that your initial training, so if you're developing if you're looking at what's happened recently and how much you have used your crisis plan, your emergency preparedness plan, and you're thinking about an overhaul, you want to make sure that you are definitely including new and existing hospice employees in any training that you have. We talked about pulling in your contractors, so your pharmacy, your DME. Don't forget about your physicians that could be contractors, right? Sometimes they're not employees. So you want to have your list of contractors, not just for your survey, but also for use in making sure that you're touching everyone that needs to be communicated with in regards to emergency preparedness. So, of course, we don't want to forget our volunteers. They make the world go round, and a lot of times they can be your very strongest advocate and asset in the midst of a storm. So that crisis and emergency preparedness also needs to be communicated with them, and really engage them and find out ways that they can fill in the gaps that you've identified as you've gone through and reviewed, or maybe you're doing an overhaul of your crisis plan. So you want to make sure that you are demonstrating emergency procedures. I talked a few minutes ago about that fire drill that that we had at a hospice organization. So that's a real way to do it, right? So in that initial training, make sure that you have activities and your team is able to give a return demonstration on what you are teaching them. So very important. So this has to happen every 2 years, or if significant changes are made to your policies and procedures. So that training needs to happen. And so make sure you guys, after this webinar, go and look and see when you had your last training. So it has to be within 2 years. So make sure that you've done that. And you want to make sure that you're doing a review and rehearsal of your emergency preparedness plan. So outside of your initial training, you just want to make sure that everyone knows what their part is. So that rehearsal, so maybe, you know, everybody says, okay, well, let's try our mode of transportation, communication. We're going to do that next Tuesday. We're going to have an all-staff meeting, so let's make sure that we cover that, right? So then you're actually able to see how it works. You can do it while people are out in the field as well, but that's just one example. So you really want to make sure that that focuses on the procedures necessary to protect patients and others. And when I talk about others, I am talking about their loved ones, and I am most certainly talking about your teams. So things to think about. We don't operate in a vacuum. We agree that we're going to take care of the patient and their loved ones. That's what we do. So make sure that you're keeping that at the forefront of your training and your emergency preparedness plan in general. So, Laura, you want to talk about the drills? Oh, maybe I lost her. So let's talk about, are you there?
I'm sorry, I'm still here. I was having a hard time getting off mute. Thank you. Yes, so when you're looking at your drills, each year has a different purpose, and you should approach them as such. So we understand, and I think it really has been highlighted with COVID, the need for community, the need for partnership. And so from looking at your year one, you know, if you have recently gone through a drill and, you know, you might be utilizing this webinar as a way to kind of do an autopsy on your plan and see where you might want to fill in some gaps. You can begin planning for, you know, a year from now and what that year one drill looks like. That year one drill should be community based, and it should be full scale. You know, if you're working with your partners, working with a healthcare facility, et cetera, the larger impact that you can make, the better off that you are, because that will help to not only test the strength of the plan, but that will make it as realistic and likely so that your team really understands the full impact of the weight of the crisis. You can also see where your teams shine, where they excel, and you may have, you know, folks that really operate with grace under fire in a way that you would not have anticipated, and so you might want to reassess their role in the plan as a result of how they perform. You know, some folks, you know, you have either the fight or the flight. Some folks are going to fight, and some are going to flee. Or freeze. And so utilizing these drills is a good way to assess how they're going to operate. If you can't do a community-based, certainly an individual exercise works, but making it as large as possible certainly is beneficial. In your second year, you know, a community or an individual, you know, based on what your resources are and what's available within your area, having that mock disaster drill, or at the very least doing a tabletop exercise, gathering everyone around during a staff meeting, having a facilitator. That can either be someone within your organization, although it probably is best to have an outside unbiased third party come in. Perhaps you have a partner of yours and you can do the same for them. You can take turns helping to facilitate, but they can be an unbiased third party who can sort of help oversee how the situation plays out. You need to have, a clinically relevant emergency scenario. So whether that is a tornado has rolled through town, whether that is you've had a data breach or a hack, and your records are frozen essentially. Whether there has been a plane crash and your administrator did not survive. Whatever scenario you're looking at testing, that tabletop exercise should focus on that. You need to have your problem statements ready and your messages ready to go as well. You also need to challenge the plan. As I talked about, crises tend to beget more crises. So let's say that there's, you're doing a crisis with bad weather, and one of your senior leaders needs to then leave immediately to go pick up their child from school because bad weather is threatening the school that the child attends. So that person then is removed from the scenario, and yet the work still needs to continue. So what other monkey wrench can you throw in the plan, essentially, in order to make this as realistic and lifelike as possible?
Yeah, Laura, I do want to just a couple of things here. We know that community-based full-scale exercise is not a requirement anymore for hospice organizations. So that's been removed, but it's still a best practice. So you want to make sure that you're going above and beyond when you're doing your testing. And I would also suggest, if there is a weather warning in your area, you can get started and get busy starting to document what you did for that warning, and that can be evidence of a test or drill. Just quick, easy ways to be compliant. Don't do that all the time, but you can certainly leverage that as needed. So I want to touch on the references and resources here. As promised, we provided those. The Tracy, the second one, has really great tools. And as you go through and look at these, make sure that you're looking at your state specific resources. So the State Office of Emergency Management very likely has their own website. While I was preparing for this presentation, I found numerous resources, state-specific resources. So make sure you look and see what's out there. Leverage these resources. You don't have to start from scratch, but we certainly want to make sure that you have tools and resources to be successful. So that ends our presentation. Laura, the expert communicator, it's always a delight to present with you. I don't know, can you see if we have any questions in the chat?
It doesn't appear that we do. I think we've answered everyone's questions already throughout the content. So certainly if you do have questions, or if something comes up later this afternoon or in conversation with your team as you're talking about what you've learned today, if they have a question and you want to reach out to us, please feel free and email us. Our emails are there on your screen. We would welcome any questions or feedback that you may have. Certainly we want to provide the right kind of information to help you and your organization. So please feel free to reach out to either one of us for input and feedback on your crisis plan. We would be more than happy to help. We want to thank you guys for spending an hour of your day with us. As we talked about, we know that working in your business is probably priority one, and so taking a step back to work on your business really takes a significant commitment. So we really appreciate your time today. And as we talked about, everyone's going to be getting a recording of the webinar as well as that crisis checklist. So be on the lookout for that, and feel free to share that with your friends, and feel free to visit axxess.com/hospice to get a look at our hospice solution. We would love to learn more about you and your organization and how we might be able to partner together to help you grow. Have a wonderful day. Thank you so much.
Thank you for joining our on-demand training today. Axxess is the only home healthcare technology company approved by the American Nurses Credentialing Center to offer continuing education credits and the most recommended home health software on Software Advice. You can watch more on-demand training videos through our industry-leading help center or at axxess.com, where you'll find tutorials, blogs, white papers, and answers to frequently asked questions. Axxess, empowering care anytime, anywhere.